Good morning, everyone, and happy 2017. It is January 5th. I'm Deb Wilkinson. I'm the Vice President of the Health Plan Options here at URL. My job duties include overseeing the individual and group health markets for our broker partners. And the reason I mention this is because there are some new folks on the call today, and I thought we'd just start the new year the right way and introduce everyone. So anyway, I just, again, wanted to wish everyone a happy new year. It's the time to kind of look at where we're at and set goals for the year and hopefully attain those goals. And my message to you is that URL is here to help you attain those goals and reach them. We try very hard to make your jobs easy and provide all the support that you need. So if you're not familiar with how we process our individual or group health business or our employee benefits, disability, life, annuities, etc., the senior products, give us a call, and I'm happy to kind of let you know how we work, and happy to have you all as our agent partners. So let's jump right in. First things first, incentives. Highmark has come out with an incentive for the Lehigh Valley product, the Lehigh Valley Flex Blue product, and the Alliance Flex Blue product. And any sales from January through July for the Lehigh Valley Flex Blue product sold in Lehigh, Northampton, and Schuylkill counties, that will get you the bonus that you see here. It is cumulative, so based on the number of lives in that product, again, Lehigh, Northampton, and Schuylkill counties that you sell from January 1st through July 1st, that will be counted towards a bonus, an additional incentive. Also, starting February 1st through July 1st, Monroe County, up in northeastern segment, will be offering that same bonus on the Lehigh Valley Flex Blue. Additionally, the Alliance Flex Blue product in Dauphin, Cumberland, Perry, Lebanon, and Berks County will also be eligible for that bonus from 1/1 through July 1st. So again, these are things that certainly help the bottom line, and if you want to know more about the products or see some quotes for the products, give your case manager a call, give us a call or me a call, and we'll help you get those rates. But definitely something to look forward to and earn some extra dollars. On to the next bullet point. We've been getting a lot of question about the revision of the health reimbursement arrangements for small employers, those with 2 to 50, and reimbursing for individual health. Of course, before the DOL put a squash on that, in December of 2014, it was very popular for an employer, a small employer, to say, you know what, I'm not offering group coverage, but if you go buy a policy, I'll reimburse you up to X amount through the Section 105 or health reimbursement arrangement. And of course, anything that runs through the HRA is an employer line item write-off. So obviously, there were some tax incentives for the employer to do this. As of 2014, the DOL put a squash on that and basically said if the employer is doing this, it can't be done through an HRA, it can't be tied to health insurance, and the most the employer can do is really bump up a salary to kind of mitigate any cost that the employees might have going on the individual chassis. So that wasn't that wasn't really a great thing. And now, as policies that are sold effective 1/1/17 and beyond, if an employer, small employer, wants to reimburse through HRA, they can do that. However, the employer can only reimburse up to $4,950 annually for a single or $10,000 for family. And the biggest issue is that if the employer chooses to do this, then the employers are ineligible for any tax subsidy. So again, you're paying full price on the individual side, reimbursed for close to $5,000 or $10,000 for single or family. So the cost of a single plan you know, an individual health plan versus an employer plan could be more to the employee, and certainly cost more to the employer without offering those tax incentives. So bottom line, the HRA revisions are there for policy sold 1/1/17 and beyond. If you want to learn more about it, give me a call. I can walk you through the you know, the advantages and disadvantages. But at this point, with group health premiums being less expensive than individual premiums, I don't really see a huge advantage with this recent change. I wanted to mention the URL's group resource page. We are still updating for 2017, so just be mindful of that. Elise and her team are getting the stuff down to our IT department as quickly as we get it in, but just be mindful that some of the information on our resource page is still in the process of being updated for 17. January 10th, which is next Tuesday at 10 a.m., we are having a Self-Funding 101 webinar, and that is being sponsored by Starmark. Gino Gambardelli, is going to be the presenter, and he's going to talk about his product. It is a national product. It is a level-funded product, and certainly something worth learning more about. Let's start the year out right by learning things that we may not have known. So if you want to join in, go to our website and you'll be able to register, or just shoot me an email and I'll send you the link. Happy to do that. So my next bullet point is kind of cryptic, and I say, so it's begun, sometime, maybe, eventually, wait for it. You know, of course, with the new administration coming in on the 20th, there's a lot of talk and a lot of action, actually, with the 115th Congress, and it does appear that the administration is going to move forward very quickly with changes to the Affordable Care Act. There are a couple articles in my newsletter today, but you know, there's a 4-step program that I put in there, the article, and basically step 1 is that the Senate intends to pass a budget resolution next week that would shield repeal legislation from a Democratic filibuster. That's a mouthful, right? And the article just goes on kind of, again, in a 4-step way of showing how the changes to the ACA could take place. Some of the highlights of the legislation and this reconciliation bill would be to eliminate the tax penalties imposed on people who go without insurance and on larger employers who do not offer coverage. So that takes care of the individual tax penalty and the employer mandate. So those are all good things, in my opinion. They're going to eliminate tens of billions of dollars provided each year to states that have expanded eligibility for Medicaid. Of course, President-elect Trump's plan is to put the Medicaid dollars back in the state's hands and use those for a Medicaid program that is state-specific, that meets the needs of the specific states versus a national approach, and repeal subsidies for private health insurance coverage obtained through the public marketplace. So there, again, take a look at my newsletter. There's a lot of information in there about what their plans are. How quickly this happens, you know, is yet to be seen. I know that that is top priority for this new administration, and you know, but I think it will take a few years to unravel, and we'll see what happens. 17, of course, is a done deal. We'll see what happens when the carriers start filing for their plans in 18, April or May. Next bullet point, I wanted to remind you about the summary of plan documents and the POP documents. This is a complimentary service that URL offers to our group health producers. So if you've recently wrote a group or even wrote a group at all with us in the past year, reach out to me or reach out to the group health team, Elise, Katrina, or Thomas, and ask them to get you the booklet to get these summary of plan documents and or POPs created. Again, it's complimentary, and if the DOL audits these groups and they don't have a summary of plan document, they could be faced with $110 per employee per line of coverage per month. So again, it could be very substantial as far as the penalty if they're found to not have these documents. So my theory is we're offering them for free. Let us know if you need them. Offer it to your group clients as your own value add, and it's a win-win for everyone. Another reminder of our Gemini Partners program. It is, again, the beginning of the year. It's time to, evaluate your relationships and, take a closer look at URL Insurance Group. If you're not doing your lines of coverage with us, health, individual and group, employee benefits, Medicare, annuities, life, individual ancillary, all of those. If you're not doing them with us, then take a look at the Gemini program and possibly look at how it could benefit you by becoming a Gemini partner. The Gemini program is essentially giving URL the right of last refusal. If we offer the programs, we want you to write it through us, and we reward you for that. Each department has a quarterly bonus for our Gemini partners, and the group health department specifically had for 2016 a $50,000 Gemini shared bonus pool, where if you even wrote one group, 2 lives with us, and we're a Gemini partner, you get a piece of that $50,000. This year it's starting at 25 and building throughout the year, so we fully expect it to be at the level it was this year or even higher. But that's money sitting out there. If you're doing your business or want to do your business with us, then it's certainly something that you should look into. And again, if you want to learn more about the Gemini Partners program, give me a call. I'm happy to explain it. And that's it. That brings us up to our open forum where you can ask questions and hopefully we can answer them. Just a reminder, while you're calculating and typing in your questions, our next webinar is Thursday the 12th, and I look forward to talking to you all then. So let's open it up for questions. Oh, we only have one, I think. It's from Elise. She says, for the group health resource page, that the carrier updates were sent to the marketing department but aren't finished, so if they need to make sure they have the correct form, just contact Elise, Katrina, or Thomas, and they can make sure that you have all the updated information before you submit. And that's it. That seems to be the only question. And as always, I look forward to talking with you next week. Call me in the meantime if you have questions. Thank you for your business. I wish you all a very happy year, and hopefully we can do more business together in 2017. Enjoy your day. Bye-bye.